Welcome and thank you for taking the time and effort to attend this session. This has been a year requiring adaptation and change. Initially, our session was focused on discussing APP practice status post-modulator therapy, but then we had to include COVID-19 and also a remote presentation into the mix. We appreciate your flexibility and understanding and coming together as a group to discuss and support each other during these challenging times. Your moderators today are myself, Lynn Fries, and also Cindy Brady. Housekeeping, not much in the way. For goodness sake, you might even be watching this from your own house. I'm going to lead off with a review of the results of our recent survey efforts. Cindy Brady will update us on the APP task force efforts to assess current practice and issues to determine future needs for APPs and cystic fibrosis care. Cindy George and then Jordan Dunitz will discuss the commitment from the foundation and plan from the foundation for this process, as well as potential curriculum development. There's no disclosures from me regarding this presentation. Many people express fear at the prospect of public speaking, but for myself, I had a lot more anxiety about trying to convert to a remote presentation, so I hope this goes okay. We did a brief survey recently. Admittedly, there were limitations in the survey. We had a limited opportunity to construct and beta test the survey. Also, the access time was limited, only about a week and over a holiday. So in the best scenario, this is a microcosm, macrocosm snapshot of what's going on for APPs and cystic fibrosis care, or it may be a skewed view due to the small sample size. This may be a pilot, and it's possible there may be a follow-up. So if that is the case, please take time to respond, as we value your input and factor that input into the foundation going forward to meet and identify needs. There's approximately 125 on our APP listserv. Most are APPs, but not all. And we got 36 responses with less than 5 minutes to complete on average the survey. Looking at what is the profession distribution, predominance of NP with some PA and then a few other. Scope of practice, it was fairly balanced between adult and pediatrics, with a chunk of people working in both adult and pediatric care. Setting-wise, a majority of people, more than 50%, are on an outpatient basis, and a significant group doing both inpatient and outpatient care. Relative to years in CF care, most were seasoned providers with more than 3 years in CF care. We wanted people to try to estimate what percentage of their job was devoted to cystic fibrosis prior to the onset of highly effective modulator therapy and then COVID-19. So at least 50% had 75% of their position or more dedicated to CF care. Currently, we wanted to know what people had a percentage devoted to CF care, and it appears that there's a slight decrease in the dedicated percentage to CF care. Going forward and projecting over the next 2 to 3 years, it does appear that there's perhaps a bit smaller percentage additionally allocated to CF care by the projection of the respondents to this survey. Then we wanted to know how CF care has been affected by the onset of highly effective modulator therapy. We have had 2 pivotal changes with modulators and then COVID, so trying to tease out the effects of each. The other segment does reflect additional comments. So there's the flat out yes, and then the other segment, which shows that the majority of APPs have had some impact on their practice with modulators. Checking all that apply, many ways of modulators have affected workload. We see a shift from inpatient to outpatient management, and under the other category, comments included lower admission rates, lower sick calls or home IV, antibiotic needs, but more time coordinating labs, prior approvals. Pediatric provider comments show less change in need for patients under 12 because less modulators are prescribed in that group. So their practice was not changed as much by modulator therapy. And have admissions changed? And overwhelmingly, yes, less admissions. And under the other session, that also reflects additional comments. So that is added in with overwhelmingly lower admission rates. Then looking at CF workload with COVID-19, again, more than 50% are affected. Remember that others also reflects comments. In the provider note, use of telehealth is commented, especially early on, and some remote work being done by APPs and CF Care. Interestingly, new providers note that they don't have anything to compare practice to, so they don't know how it would change because they've come on since modulator and COVID. We see that COVID has triggered less time in clinic, and under the multiple other comments regarding telehealth, phone management, prior authorization, additional non-clinical tasks, and letters being needed, letters of necessity. And when we look at the changes from modulators and COVID, there is some trend that is opposite to our stated goal to move APP practice to optimize the scope of practice. But it does show that we've been flexible in meeting the emergent needs, and we'll need to consider these factors as we go forward with future planning. We wanted to know if people's pay or benefit job security have changed with the advent of modulator therapy and or COVID. As with much of America, almost half have had some impact. The statements that are under the other or red component include required furloughs, mandated use of PTO, delay or hold on merit raises, and discontinued contributions to retirement plans. A lot of that was related to COVID specifically. Regarding job security, if we look at this pie graph, less than 50% in the past 6 to 12 months felt fully secure in their job security. And in the next 6 months, less than 50% feel secure. And the secure wedge is smaller than on the previous 6 to 12 months. Other comments reflect that APPs may have to add non-CF care to support their positions. Patients are hesitant to come into clinic appointments on site, and so their outpatient clinic visits are down. And one APP near retirement is concerned that the position may be eliminated after his or her retirement. Looking at future need and current need, currently is there a need for additional cystic fibrosis providers, whether doctors or APP at CF centers? The definitive yes on this pie graph is only about 1/3. Some of the comments reflected specifically a need for a pulmonologist or a center director. Also, there were isolated remarks that a recently added position was only part-time, and one APP position was converted to an RN position. Going forward, our respondents commented on whether there was going to be a need for CF providers, either physicians or APP in the future. And here we show quite a bit of uncertainty, and a small sample reflects only a limited definitive need in the blue wedge for future additional providers. Random comments reflected uncertainty of the longitudinal effects of COVID and modulators, and also one comment on the possible need for APPs to do more independent visits. On a good note, we would show that fortunately most respondents are interested or see potential benefit from APP training programs. And our next speaker, who will be Cindy Brady, is going to speak about leadership and education for advanced practice providers in cystic fibrosis and the path forward. I'm going to offer a few random comments. These are my editorial comments and rumination, and not reflective of the station or management. First and foremost, we need you. APP input is really important going forward to support practice in general and also post-modulators, and now with COVID-19. We need to update APP data. The listserv is a tool for this. We did note that some APPs did not enroll when the format changed. And so we would encourage anybody who has not done that to get on the listserv or encourage their colleagues to do so. Also, CF admissions and exacerbations are on the decline, fortunately, with modulator therapy. And many of the APPs that are seasoned in CF care are aging out and nearing retirement. So I wonder how we're going to train and mentor and transfer expertise to new APPs in CF care when these new providers are going to see fewer exacerbations and may need to move into other areas of practice to support their positions. So please stay tuned for our next speakers on these issues and also join the live chat. Here's the details on the live chat, and we hope to see you there for some robust sharing and support and conversation. Looking forward to your input.
I want to thank Lynn Fries for her presentation. Hi, I'm Cynthia Brady. I'm a pediatric nurse practitioner at Children's Respiratory and Critical Care Specialists and at the Children's Hospitals of Minnesota. I'm at the CF Center. I've been taking care of children with cystic fibrosis for about 25 years. I've seen many changes, but nothing like today. We are all affected by COVID, racial unrest, natural disasters, fires, hurricanes. It seems now that the only certainty is uncertainty. COVID has turned many things upside down. It's resulted in rapid changes in how we do our work, televisits, rethinking our whole processes, structures, 4 visits a year, labs. Some of us have had to work less or differently. We've had our pay or benefits reduced. It's caused a lot of stress and anxiety, not only for ourselves, but our patients, our institutions, everyone. Someday COVID will pass, and we'll be able to more clearly look forward, especially the path of APPs in CF practice. And that's what I want to talk about today. Patients with cystic fibrosis are benefiting from the work of everyone for the past 5 decades, parents, scientists, caregivers, and they have a brighter future than ever. My only disclosure is that my work on this project is supported by the CF Foundation. I'm going to start with a review of how we got where we are today, or before COVID. 2 years ago, the Cystic Fibrosis Foundation formed a task force to examine the role of advanced practice providers in CF care and make recommendations for the future. The CF Foundation, as did and as has many other healthcare institutions, has become aware of the looming shortage of qualified providers for CF care. There's many openings for physician pulmonologists forecast for the future, and anecdotally this was known. The other thing is APPs have been long involved in CF care and have provided competent quality care to patients with CF, and they've been important members of the CF team. The result of the work of this task force was to write a white paper that was submitted to the CF Foundation. You can find this on your mycff.org login under the resource library. Use the search bar and type in APP white paper. Unclick the match exactly, and you'll come up with both the white paper and the executive summary. take a look at it. We welcome feedback all the time. The first thing the task force did was to survey advanced practice providers and program directors. We also surveyed patients and family members. What we found was that the majority of CF centers were recruiting physicians, and 80% were having difficulty doing so. 75% of CF centers employed APPs, and that was up from 53% 10 years prior. 90% of program directors plan to employ APPs in the future. 63% of us were serving in some sort of leadership capacity, and the vast majority felt that APPs were qualified to take on even more leadership roles. When we looked at job satisfaction, which was no surprise, we found that 88% of us were trained on the job. And that can be very stressful and very time-consuming. It can take a long time if you're trained in sort of an ad hoc way. In addition, things that informed our job satisfaction was our ability to practice at our full scope of practice and be able to collaborate with our physician colleagues. But we found that 35%, so more than a third of APPs, were not practicing at our scope. There were definitely barriers, things like inadequate staffing, poor understanding of our role, and the dreaded prior authorizations. Our recent survey has also supported that, and we found that people are spending more time in the age of highly effective modulators trying to do prior authorizations and chase down all the labs that are needed. These are more non-APP, non-full scope tasks. We found that there was a real need for better understanding of our role and our potential for professional development. So we made 3 recommendations from this white paper that was submitted to the Strategic Planning Committee of the CF Foundation about a year ago. The first was to enhance partnerships to support our full scope of practice with center directors, APPs, physicians, team members, and the CF Foundation. The second recommendation was to create a core CF curriculum that could be accessed anywhere online. And the third was to establish a postgraduate fellowship program for APPs in CF. We wanted to accelerate the time it takes from being a novice to a competent, independent CF provider and take off some of the stress. So we proposed 3 fellowship paths in 2019. The first one, option 1, is targeting the novice or brand new grad APP with no APP experience. This would be a one-time, 1-year, in-person, full-time fellowship at a large academic CF center, coupled with an online CF curriculum. Many of these programs already exist very similarly in other specialty areas, whether it's critical care, cardiology, hepatology, endocrinology, the list goes on and on. These programs typically are hosted by certain institutions throughout the country. Your institution may have such programs. The second option is for the beginner, so someone who has stepped their toes into the world of advanced practice that has maybe less than 3 years experience and is new to cystic fibrosis. This program we envisioned would occur at a home center with mentored clinical time and use of our online curriculum. The third option is for those who are seasoned in CF care, who are already competent, but would like to explore a certain aspect of CF care, get some more in-depth knowledge, and this would be more of an independent study option. Our original plan was to go with option 1 and target and recruit new grads for a lifetime or a career in cystic fibrosis care. But COVID has changed all that. Many of these programs are on hold. People are not traveling, and this was not feasible in the face of the pandemic. So the CF Foundation has now focused on supporting option 2. So this is based on targeting the already employed APP who has less than 3 years experience. This program will replace the existing mentorship program, and it will be enhanced because it is supported by the CF Foundation with protected time and financial support of the learner or fellow. In our recent survey just a couple of weeks ago, most of your comments revealed appreciation and enthusiasm for ongoing learning and mentoring in the future, even in the face of everything going on. Many of you were appreciative about the idea of educational support and recognized that there are a lot of challenges we face. This is a work in progress, and there will be challenges. We will need your support and feedback. And many of you talked about this, that it's going to take time with the changes due to COVID, that the mentoring program was put on hold because of COVID, but there was enthusiasm for the foundation looking into and formalizing the work that we have done by this group of CF care providers. There will be challenges, and there are many things going on, not only how to learn, but the rapidly changing face of cystic fibrosis. Now, there's people that spend a lot of time thinking about how people learn. And one of these people was Patricia Benner back in 1982. She was a nursing theorist. I know, you're thinking, yawn. But actually, it's kind of interesting. She, in some ways, states the obvious. But the novice is someone with no professional experience who needs to move to competent. And physician fellowship programs bring that person up here in a quick way. Now, this is another way to look at it if you really aren't into nursing theory, where Benner has all these steps. But if we can think about the progression from a novice to a master Jedi, I think it makes sense to all of us that we're not born masters and that there's a path along the way. And with that, the CF Foundation is moving forward with what we will be calling LEAP for CF, Leadership Education for Advanced Practice Providers. This program will look to bridge that gap between a novice or beginner to competent independent practice. We're excited to announce that we are developing this program. A lot of things have happened since the survey was taken and our APP white paper was submitted to the CF Foundation, but we are excited about this path forward. The CF Foundation is continuing to support their patients by providing and ensuring that they have a competent provider workforce looking to the future. Now, here's one more theorist. This is Dreyfus, and his model of skill acquisition is much like Benner's, or Benner's is much like Dreyfus. Novice, advanced beginner, to competent, proficient, to expert. But the learner becomes the doer, becomes the teacher. Learn, do, teach. The learners become the doers who become the teachers of the future, and the cycle repeats itself. We are looking to all of you, wherever you are on this continuum, to be part of this initiative, or LEAP. Most all of you are interested in being part of this path forward. and appreciative about educational support. We know the path ahead will be faced with challenges, but if we can all draw on each other, this has tremendous possibilities. LEAP is about lifelong learning, doing, and mentoring or teaching. 3 of us that were members of the original task force have begun to work on this and outline the specifics of what LEAP will look like. You will be hearing a lot from us in the future. We need your help. We will be looking for your help and expertise. We will need fellows, mentors, and other expertise. If you are interested, please reach out. Next, Cindy George from the Cystic Fibrosis Foundation will give an overview of our programmatic progress to date on LEAP for CF. Thank you, and thank you for all you do.
Hello. I hope that you are all well during this very trying and disruptive time. My name is Cynthia George. I'm a senior director at the Cystic Fibrosis Foundation, and I'm a nurse practitioner. And before joining the Cystic Fibrosis Foundation, I had the privilege of working with adults with cystic fibrosis and co-creating an adult CF care program here in the Washington, D.C. area. I'm honored to be part of this APP community and appreciate your dedication and hard work to providing excellent care to people living with cystic fibrosis and their families. I want to thank Cindy and Jordan for their leadership in the previous task force, as well as spearheading this new LEAP CF fellowship program that we are excited to tell you about today. I would like to disclose, if I go to the next slide, that my only disclosure is that I work for the Cystic Fibrosis Foundation, which supports this work. My presentation will be today about a high-level overview of CFF's commitment to improving access to care through the LEAP for CF Fellowship Program. For over 50 years, the Cystic Fibrosis Foundation has been committed to providing high-quality, specialized, multidisciplinary CF care for individuals with cystic fibrosis and their families. In supporting this care that all of you provide, there's also been some challenges along the way, and more recently there have been workforce challenges, particularly at the provider level, due to a few things. One being the national shortage of pediatric and adult pulmonologists who are trained in CF. The second, an increasing number of newborn screenings that were being detected, and also a wonderful and growing adult cystic fibrosis population. So these leave some very important needs in our CF community, and despite recruiting efforts, vacancies are still persisting. But the foundation is committed to supporting and addressing these needs, and then to training and maintaining a strong CF provider workforce. And part of this addressing the issue is around recognizing the long history of the role of APPs in providing excellent care in cystic fibrosis and providing leadership as well. And the CF Foundation, therefore, is supporting the pilot of this LEAP CF fellowship program that I'm going to tell you a little bit more about. So the LEAP CF fellowship support that we're offering, the aim of this fellowship is to recruit and retain APPs in CF for now and into the future by supporting in-depth structured postgraduate education and training in CF. And we heard, as Cindy shared in her previous recording, that protected time was needed in order to participate in in-depth learning and clinical training. And so that's what this award we're going to be issuing, a request for applications or an RFA, and that will cover a percentage of salary support so that an APP fellow can have protected time for didactic and self-directed learning and clinical training. So let's look a little bit more about this RFA. We anticipate that we'll release it in November. We're still working on the details, so I don't have a lot of details, but perhaps by the time we have our panel presentation at the end of October, I will. We envision it's going to be a 3-year award, so 36 months, and it will be covering percentage of salary that would decrease in subsequent years. So probably, I know that there'll be more salary support in the first 18 months, and then it will gradually lessen over time as training continues and on. So eligibility would be that you need to be employed and fully credentialed at your CF center and in your role for somewhere between 2 to 36 months of experience. This RFA will require a strong commitment from the institution, the division, center director, and the APP for this protected time. So let's look a little bit at the institutional and CF center commitment. We will be expecting a letter to accompany the application from the institution that would describe the support and the protection of time for an APP to participate again in the clinic learning, as well as in the didactic and self-directed program activities. There would also need to be a letter from the CF Center Director, as well as signatures with the division chief, that also describes a level of support and protection for the integration of the APP in the CF program as a provider. And I just want to pause for a moment and note that the LEAP Fellowship Program is about an APP fulfilling their licensure to provide direct patient care. Oftentimes, I know we get pulled in many other roles as coordinator and research and other activities, but this is dedicated time to really immerse oneself into becoming a CF care provider. Some of the other things that the letter will need to contain from the director and the chief will be identifying who is a local mentor that can provide this in-depth clinical training experiences. We imagine it might be a physician or it might be another APP if the center is large enough. How will time be allocated? We need a description about how time will be allocated so that there can be experience as well in both the pediatric and adult program, depending on where you might be focused least. So if you're in an adult program, it would be good for you to spend some time in the pediatric program and vice versa, just so you can get exposure of individuals at various ages. Also, support needs to happen for the attendance at NACFC annually during this 3-year award. We're really hoping to have an annual fellow meeting as well at the NACFC. And then we also need to have a plan on how will they allocate time for this educational didactic meetings as well as self-directed learnings. And from the APP, we're going to need to hear about what is the interest that one has in cystic fibrosis. We're hoping to have a strong interest. And then we also need commitment on attending the bi-monthly conference calls and webinars, completing the self-directed learnings, including in online modules, readings, review, and preparing to present on case presentations, and the work on and completion of a QI project that would follow probably in year 2. Attendance at a CF clinic, we're hoping would be a minimum of 4 hours a week, whether that's a clinic rather or inpatient care, again, depending on the focus for the center. If your center is large enough, we hope that it's more than a minimum of 4 hours a week. Attending NACFC annually, again, that commitment to go to NACFC, and then also a commitment to work with both the local and the national mentor. And Jordan's going to follow this talk and talk a little bit more about the curriculum in this idea of the mentorships and the 2 types. So how will we know, how will the community know about LEAP CF Fellowship? Well, there'll be an RFA notification through several means. We'll post it through the APP listserv, and this APP listserv is no longer on Dartmouth listserv. It's on my.cff.org under the CF Exchange. And because recently we found out that many APPs are not signed up, the next slide I'll walk you through how to sign up for that, because you can get some really up-to-date information that's important to know as you're practicing. There'll also be emails sent directly to individual APPs, and we'll base that off the email list that we have that comes from each CF center annually submits a report to the foundation for accreditation purposes. And in that, the administrator or the center director have listed all the staff that are part of that CF team. And so right now, that's how we receive your emails, and we would send that directly to you, this notification. We'll also send the notification on the RFA to the center directors and pediatric and adult program directors as well. And we'll also be posting on the new physician listserv. So let's look at how you join the APP listserv. So again, this is on my.cff.org. There's a picture you can see there, and circled is called the CF Exchange. So when you get in my.cff.org, you go into the CF Exchange, and that's how you get in these listservs. So let me talk a little bit about how to join, and I encourage you to take a snapshot or just download these slides. But you want to first make sure that you're listed in that CF care team list that I mentioned. So again, check with your center director, your admin, to make sure that you're on the document or the report that's sent every year to the CF Foundation from your center. You want to use the same email that you use for work, or the one that, again, is associated with your care team. Then you go to, you can see the link here for my.cff.org. You create an account in the listserv by clicking on Create an Account. And you want to fill in your first name, your last name, and your email address. Once inside the portal, you're going to click on CF Exchange, and then you can see that's the lower diagram or picture here. And you're going to request access. You can see CFF APP, that's the APP forum you want. And you can see the circle, you click that button which says Request Access. And you should be in. Now, if you have any problems or questions, you can certainly email me at cgeorge@cff.org. I'd be happy to help you, or one of the team members will as well. So, LEAP CF Fellowship Program, we're super excited about it. I hope you are as well. I think it's an important step for the future in addressing our workforce issues. Consider applying to be a fellow if you're eligible, or if you know somebody who's eligible, let them know about it. If they couldn't be on today or listen to the NACFC this year, consider maybe being a national peer mentor or a local mentor if that's applicable and your center is large enough. That would be fantastic. Be on the lookout for the RFA, and please join the listserv so that you can keep abreast of the new information that's coming out from the CF Foundation, but also discussions that we can have among the APP community. So I look forward to being part of the panel discussion with Cindy Brady and Jordan Dunitz on October 22nd at 2:15 p.m. I believe that's Eastern time. And happy to take any of your questions, or also you can email as well. And I want to thank you very much for your dedication, your excellence in providing CF care with people with cystic fibrosis and their families. And our thoughts are with you, your families, and all the staff at your team. So thank you very much, and take good care.
Good morning. I'm Jordan Dunitz. I'm the Adult CF Program Director and CF Center Co-Director at the University of Minnesota. I have the privilege of working with Cindy George and Cindy Brady on the leadership and education for advanced practice providers in CF. I'm going to spend the next few minutes discussing the curriculum. Just as a brief disclosure, I am supported by the CF Foundation to work on this fellowship. First of all, this is a pilot. This is our first swing at this, and we need your help. Those of you who have been doing this for a long time, we'd like to know what are we missing? What should we be considering? What should we be including that we may not have thought of? For those of you who are just starting out, what are the things that you wish you knew? What are the things that you would hope that we would include in such a fellowship? So, the curriculum. It'll be a 3-year program, 3-year fellowship. The first 18 months will be focused mainly on clinical care, pathophysiology, genetics, and the specifics of clinical care for all age groups, pulmonary, GI, endocrine, all of the important concepts in clinical care. Next 9 months will be focused on on quality improvement skills. And then the last 9 months will be focused on leadership skills. And I'll discuss briefly the curriculum for each of these sections. The most important part is the mentoring. First, there'll be a local clinical mentor, so one of your colleagues at your institution. It'll be either an experienced physician or an APP that can teach you the concepts, the general approach to clinical care of the CF patient. So this will be largely a clinical mentor involved in your day-to-day clinical training and your work in the clinic or in the inpatient setting. In addition, you'll be assigned an APP mentor, so an experienced APP for more professional mentoring, helping you to understand what is the role of the APP, what's the role of the APP within the CF center. How do you develop your role so that you're working at the top of your license? How can you do things to really have a truly satisfying career? How to work within the context of the center? How to work with the multidisciplinary team, how to manage conflict. So this isn't sort of the day-to-day how to take care of the patients, but this is more of professional mentoring. How do you function as an APP? We anticipate that there will be 3 to 4 APPs per APP mentor. There'll be periodic group conferences where where each of the fellows or all of the fellows will get together with the mentor on a conference call to discuss issues of professional function. Hoping to learn from each other, to help think about concepts that are important in your day-to-day work life. In addition, if you're thinking about being a mentor, we're planning to have conference calls between the mentors to help share ideas, share issues, so that we can give the trainees a really full experience. The clinical curriculum will be 18 months. It'll largely be driven by the CF Foundation Care Guidelines. The guidelines are a series of peer-reviewed publications covering all the major clinical topics. These will range from diagnosis to newborn screening, to the care of children and adults, lung health, and then non-pulmonary issues, complications like diabetes and gastrointestinal complications. The guidelines are written by content experts, and they're usually folks representing all the relevant disciplines for each of the guidelines. They have reviewed the literature, have summarized the literature where there is effective literature, and places where there isn't sufficient literature, often they share expert opinion as well. In addition, the care guidelines will cover some of the other relevant literature which have driven some of the current approaches to care. These topics will also be supplemented by relevant topics that are not really covered in the guideline, things such as interpreting PFTs, interpreting X-rays, lab results, that sort of thing that may not be covered in a specific guideline, but would be important in day-to-day clinical care. There'll be online modules that you can work on independently. And then there'll be webinars. We're anticipating a webinar every 2 weeks, led by a content expert. And the webinars will be specifically how to apply the guidelines and then how to approach patients when the guidelines don't necessarily fit. These webinars will be combined with case discussions. The cases will be presented by the fellows. We're hoping that your local mentor will help identify cases that are relevant to each guideline. So it'll give you a chance to work with the webinar presenter on cases, either basic cases to see how to apply the guidelines, or more difficult cases to see how to approach when the guidelines don't fit. Following that 18 months of clinical care, and that'll really be the most intensive part of the curriculum, this will be followed by a clinical quality improvement curriculum. This will be 9 months, and again, these will be webinars, but it'll be monthly webinars rather than every 2 weeks. And this will be teaching the basic quality improvement skills. And the plan would be that each APP fellow would complete a quality improvement project in the context of the course. They would identify some issue at their center that they want to address, either that they've identified over the 18 months during the clinical training, or something that the local mentor has helped them identify. A small project that could be completed over the 9 months. The idea is that each month a new skill will be discussed, and then that skill would be applied to the clinical problem, so that over the 9 months you could complete a quality improvement project. Hopefully the care team would participate in the project, or at least the relevant members of the care team, to help complete the quality improvement project over the 9 months. And in addition to or within the monthly webinars, in addition to the teaching basic quality improvement skills, we'd anticipate that the fellows would provide an update on how their project's going, what progress they're making, what problems they've run into, with the idea that the folks doing the webinars might be able to assist in overcoming any hurdles that may come up. The last 9 months will be a leadership curriculum. Again, this will be monthly webinars. And what we're anticipating is a series of brief texts, 100 to 200 page texts on general leadership principles, joy in work, managing up, so that you know how to work with different levels of leadership at your institution, difficult conversations with colleagues. And this would be more almost like a book club, a monthly facilitated discussion where we'd really anticipate a great degree of interaction between the fellows. So, you read the text, and then a discussion of how to apply the skills that the texts are describing, or concerns or hurdles to applying those texts, being facilitated by someone with leadership expertise. And while the first two portions, the clinical portion, the quality improvement portion, your local mentor would probably be playing a more significant role. With the leadership, we'd anticipate that the APP leaders, the APP leader mentors, would play a role in this, discussing how they've applied leadership skills and how they've overcome hurdles. So again, the 3 sections: the clinical section, the quality improvement section, and then last, the leadership section. Hopefully this will put together all the pieces for a really satisfying career in CF, where not only are you taking care of the patients, but you're addressing important issues in quality improvement, and then gradually developing your leadership skills within the center. Again, as I mentioned, this is a pilot. We're figuring this out a little bit as we go. We're hoping that we have a good plan here, but we really want your feedback. We're going to have a discussion section shortly, and we really hope that you'll let us know your thoughts on the plan, the curriculum, and what are the things we can do to make this a stronger, more satisfying, more exciting program. So I appreciate your time. Thank you.